We'll go ahead and get started. So welcome everyone. This is the Bidders Conference for the Reproductive Health Access Initiative. We have our request for proposals released, and it is currently up on the city's procurement website. And we are here today to answer any questions that potential applicants may have about this RFP. So just some light housekeeping. Our bidders conference today is 60 minutes. Felicia and I will stay on for the whole hour. If folks want to drop off after their questions are answered, you're more than welcome. You don't have to stay the whole time, but just know that Felicia and I will be on for the whole hour in case there are questions that folks forgot. We'll have a presentation. You're more than welcome to drop questions in the chat as we go. We ask that everybody ask questions in the chat just to help us collect our written questions and answers. We'll publish those on the city's website so everyone can have the same information to refer back to. So some quick introductions. I'm Sarah Parkham. I am Program Director of the Office of Reproductive Health. I'm joined here today by my colleague Felicia Hinton. She is a Public Health Administrator 3 here in the Office of Reproductive Health. She is behind the scenes right now, but she's an integral part, literally the other half of the office. We are a small but mighty team, and so she is collecting any notes and information that we need to publish on the website behind the scenes. So the purpose of this RFP is focused on abortion care, but is generally to provide support for reproductive health services, although abortion care support is our primary aim. These services are for Chicago residents and non-residents, but they are for services taking place in the city of Chicago. So proposals specifically should include support for at least one of the following categories: medical services, lodging, transportation, as well as other allowable expenses under the RFP. It's a difficult balance to not be too prescriptive with our allowable expenses while keeping some flexibility for what organizations need in what is a time of great transition and strain. So some background, many of you remember that this initial investment was released in the summer of 2022. We had an initial RFP and awarded 2 contracts in that first mid-year award, and then added a third the following year due to some increase in funding from the city. This current RFP is another mid-year award. We don't tend to do that very often at the city, but that's just how it worked out. So we'll have a contract start date of July 1st. That first award is a 6-month contract period that will go through the end of the year. The city runs on a calendar fiscal year. And then future contract extensions will be for a 12-month contract period. So that will be business as usual going forward. And then our deadline to apply, I want to make sure that everyone hears me loud and clear. The city's procurement website will close the application at noon on April 10th. So it is not closing at midnight. People are really used to things being closing at 11:59 p.m., but this does close at noon, not midnight. The system will shut off. We cannot give you access. Felicia and I will not have access to the system. So please don't wait. Apply early. You can always start your application and save it for later, but don't forget to hit submit in advance of that noon deadline. And then folks know how to access the RFP through the procurement services website. It's a little clunky. There are no paper copies. Everyone's used to doing things online now, but we just have to disclose that we're not going to be giving paper copies to people. And then if you have trouble finding the RFP, you can always email Felicia and we can do a step-by-step of how to find it. But you don't need to log in to have the RFP itself. It will download as a PDF. So again, you can download it as a PDF and you don't have to log in to access the RFP itself. If you need an account for yourself to be actually the one submitting the application, you will have to get access from somebody within your own organization. They have the capabilities to grant a new account to you Unfortunately, we cannot do that for you at CDPH, and actually the help desk, it can't do that either. If your organization has an account, you have to get somebody within your own organization to grant you access. So this is in the RFP itself, but these are important guiding principles that respondents should demonstrate that they're aligned with. These are our guiding principles under our CDPH, deconstructing racist systems, trauma prevention and trauma-informed services, cultural responsiveness, and health equity in all communities. So the other aspect that is specific to this RFP is demonstrating that you have alignment with the reproductive justice principles as defined by Sister Song. So the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. This is a scoreable part of the RFP, demonstrating alignment with both sets of principles. I went too far ahead. So eligible applicants are nonprofit organizations, demonstrated history of work in Chicago, good standing with the city of Chicago, meaning you don't owe us any money. And you have the administrative, organizational, et cetera, capabilities to implement this project. And if there are agencies with limited capacity to administer this, we know it is a burden to be on a reimbursement only system. We do allow and encourage subcontracting with being a subcontractor of a larger organization to provide those administrative services, because we know not everyone can carry the administrative burden of contracting with the city, because we do take a good amount of time, unfortunately, to get our contracts executed, and folks are operating on a reimbursement only basis. So that could be difficult for folks. We do have total funding each year for this initiative at $2 million. Our first contract period is truncated. So the award, and it is clarified in the RFP, an amendment was published late last week. So the first contract period is 6 months. So it's $1 million for that first contract year. The contract year is only 6 months, so it's half the money. And then all subsequent extensions are business as usual, 12-month extensions funded at $2 million per year as the entire pot of money available. So it is a little bit odd. Like I said, this isn't like how the city likes to do business, as award these mid-year contracts, and that's why it's a little bit confusing for folks within the RFP. It is a $2 million annual available funding, but we do just have to cut it in half for that first truncated year. So we're asking everybody to submit these required components. And I do want to highlight that even if you aren't submitting staffing as part of your budget, you should still submit a staffing plan, because we will want to know the level of commitment from the organization in providing in-kind support from staff. So tell us what those people are doing. Tell us what those people's titles are, and how they will be contributing to this project, and what their salaries are, percentage-wise of what you are providing in kind to this project, because that is helpful as well. Even if your entire salary is for medical services, there are still people working on this project, and it is helpful to evaluate what support the organization is providing in kind for the project. So I do want to highlight that even if you aren't putting staffing and personnel costs in your budget, do still submit a staffing plan. Same thing with the work plan. The work plan really just helps describe the way your organization operates and the process involved in how you would spend these dollars under this project. So who is involved, how the case or the individual that you're serving kind of moves through the organization. That all belongs in the work plan. That all belongs in the staffing plan. To the extent that they overlap, there is no issue with being repetitive. If there's a lot of crossover between your work plan and your staffing plan, that's okay. I think you'll have to reference the people who are involved in your staffing plan in the work plan. And so don't feel self-conscious about repeating yourself or defining things in two different places. It's a little tedious, but it will help in the evaluation because the people who will be evaluating these proposals are working with the four corners of the document in front of them. So it never hurts to be repetitive in your work plan and your staffing plan. Same thing in your budget. There's a narrative in your budget, but a narrative section in your budget. You can be as detailed as you, maybe you won't be as detailed in this budget, but you can also provide detail in the budget that also shows up in the work plan and the staffing plan. So we understand that it's a little tedious to possibly be repeating yourself, but it is helpful because you'll be scored on these components individually. You'll be scored on the budget in one section, then the work plan, then the staffing plan. And we need to make sure that you're accurately capturing all the work that your organization is doing for this project. And then 2 letters of support. I never like people to be surprised about letters of support. And it does tend to get buried in the RFP itself. And so I do see your question, Len, about resumes. Let me double check the RFP. I do not believe that resumes are required, particularly because of the sensitive nature of this work. I don't believe they are required because of concerns about having people's information in a public document. So I don't believe so, but we will double check and we will get back to you. And so just note that the letters of support are required and make sure that you get those in enough time. So that's something that I never like people to be surprised about when they go to submit their application if they haven't read through that part. And then fiscal capacity. I touched on this a little earlier, but we do operate on a reimbursement only basis. So it is important to demonstrate the financial capacity to fund the program from the start date of the contract until they get reimbursed by the city, which folks may know can be several months. So it is not ideal, certainly, but that is something that we want to see, that you as an organization can shoulder that financial burden. And then these are some requirements that respondents will have to be aware of. You'll need to submit program reports on a quarterly basis, invoice CDPH on a monthly basis, and that will require de-identified documentation with details of the expenses. So we'll work with awarded organizations to make sure that those details are captured. And just knowing that this is something, I never want people to feel surprised by the requirements of something that they are applying for. So we want people to be aware right away of the things that will be required of them once the funds are awarded. And then this is some detail about how to use the city's procurement system, the iSupplier system. Folks are likely familiar with this, and this slide will be posted on the procurement website, so you will be able to reference back to it. But really, honestly, I think your first stop should be Felicia. She is collecting all the information, so she honestly is your best bet in terms of a place to start, and she will get you the right answer. Again, the deadline for submitting your proposal is noon on the 10th. If you need, I believe everyone on this call has access, but if anyone else in your organization needs access, they say we're told 3 business days. Make it 5 just to make sure. But if somebody else needs access because they're going to be actually the one submitting, they will need that access. And then there is a deadline for questions. It's 3 days after this bidders conference. That ends up being a Saturday. Honestly, I do not like to hold people to this deadline for questions. We understand that questions come up throughout this process. So email Felicia anytime. This deadline is not something that we're really going to be too strict on because we know questions will come up in the coming days and weeks. And so it just is automatic that the city sets that deadline for 3 days after the bidders conference. It does happen to be a Saturday. So we won't be checking emails on Saturday, and hopefully you won't be sending any. But send those questions to Felicia if you have them, and then we will go from there and get you what you need. And then that question and answer document that's posted on iSupplier will continue to be updated. So we will let folks know once updated questions are posted. It's great that you have attended so that we have a record of folks who attended the bidders conference, and we will be able to easily share that information back with you if there's amendments to the RFP, which we don't anticipate, but just in case. And then those Q&A documents will be posted and refreshed as needed. So that's all I have. I'm going to stop sharing my screen. We'll continue to record. But if you have questions, please drop them in the chat and let me make sure that I have that question from Len answered. The resume question. Okay, I will get back to you on the resume question. Are resumes required as part of the staffing plan? I don't believe so. A narrative about the position, I think, is adequate. And if you're not requesting dollars to support the personnel, should it be reflected in the budget? That's a good question. I don't think so, but I will double check to see what the consensus is there. There probably is a best practice across RFPs, because you can't be the first person to have asked that question. So we will get the answer to you. Those answers will be posted on the procurement website. Okay. Great. I think that's our only question in the chat, right, Felicia? Yep. Okay. Any questions from folks? You're certainly welcome to hop off if you have gotten everything you need from this meeting. And thanks so much for attending. Okay, great. No questions. Do reach out if you have questions. All right, so going once, going twice. I will stop the recording. We'll pick it back up if others join. But thanks so much for attending, and we look forward to any questions you might have. Thanks, take care. Okay, so let me just stop the recording now. And if others join, we can pick that back up. Stop recording.